This conference
multiphasic.
will now be recorded.
In a multiphasic pills, it will be divided into biphasic and triphasic. Whereas progestin only pills, that is only it contains only progesterone, that is again is also called as mini pill. Overall view, the ossipil is divided into combined ossipils, progestin only ossipils. In combined ossipils, it contains both estrogen and progesterone, which is again divided into monophasic and multiphasic. In multiphasic, the other group is biphasic and triphasic. How they are divided into monophasic and multiphasic is based on the how much amount of estrogen and progesterone. If it is the same, if the same amount of estrogen and progesterone is there in the monophasic, in whole the tablet sheet, it is monophasic. If it is the difference in the estrogen content and progesterone content is differ when it is differing from some tablets to other tablets, it is multiphasic. Coming to the monophasic pills, it contains low dose of estrogen, that is ethinyl estradiol of 30 to 35 micrograms. The trade names are Mala D and Femilon. The Mala D and Mala N are freely supplied by the government. There will be a government supply for Mala N and Mala D. The other type of monophasic pill is high dose pill, which is estrogen, in which the estrogen content will be 50 micrograms. The trade name will be overall L. Multiphasic pill, it is divided into biphasic and triphasic pills. Coming to the multiphasic pills, that is the biphasic and triphasic. In the monophase pills, it contains only estrogen, and that is low dose 30 to 35 and high dose 50. In biphasic pills, it contains constant dose of ethinyl estradiol of 35 micrograms and low dose of progestin for first 10 days and higher dose of progestin for the next 11 days. Coming to the triphasic pills, in the triphasic pills, both estrogen content and progesterone content varies among the days of the pills. In the first 6 days, it is of 30 micrograms and 50 micrograms. Coming to next 5 days, 40, 75. Coming to the last 10 days, estrogen again decreases to 30, but whereas progesterone increases to 125 micrograms. These are the types of biphasic, monophasic, and triphasic pills. Combined ossipils. Combined ossipils contain both estrogen and progesterone. Estrogen content is ethinyl estradiol, which is a very potent oral estrogen. The dose of estrogen in the combined oral pill ranges from 15 to 50 micrograms. If it is in a low dose, it is 30. In a high dose, it is 50. Ultra low dose pills are also present, which is of 10 micrograms of ethinyl estradiol. Low dose pills are safe when compared to the high dose pills. Coming to the other hormone in the ossipils, progesterone. The progestation derivative of testosterone designated as 19 not testosterone. In the first generation, it is divided into 4 generations based on the derivative. In the first generation, it is norethindrone. Next generation, that is the second generation, norgestrol or levonorgestrel, LNG, which is also called as. Third generation is desogestrel, gestudine, norgestimate. And fourth generation, dinogest, drosperinone, nestrone, nomegestrol, and trimegestone. This is the progesterone derivatives. Based on the derivative, it is divided into 4 generations. Neoprogesterones have no androgenic action. Main function of progestogen is to counteract the undesirable side effect of estrogen, such as endometrial hyperplasia, heavy withdrawal bleeding. The third generation progestins, that is the desogestrel, gestudine, norgestimate, inhibits ovulation also. Types of monophasic combined pills. In the first generation OC pills, it is ethynyl estradiol of more than 50 micrograms. That is norethindrone. Next, second generation, ethynyl estradiol 30-35 micrograms, LNG, norgestimate or norethindrone. Third generation is your ethynyl estradiol with gestodril and gestodon. Here, the progesterone contents are different based on the generations. In the fourth generation ossiples, that is here there will be low dose of ethynyl estradiol, that is 10 micrograms, with your fourth generation of progesterone, that is drospirenone, dinoges, normogestrol estate. Here the drospirenone is also called as a beauty pill because it has low androgenic side effects. What are the androgenic side effects we commonly come across when a patient is using ossipils are facial hair, fluffiness, pimples, so breast heaviness and tenderness. All this will be decreased when the patient is using drospirenone. That is the fourth generation progesterone derivative or fourth generation ossipil. Low dose oral contraceptives, that is ethynyl estradiol less than 50 micrograms. Ultra low dose pills is 10 micrograms. Near combined ossipils contain estradiol valrate E2V plus fourth generation progestins. What are the fourth generation progestins? They are the drospirenone, dinogest, normogestrol estate. Commercially available monophasic pills are the overall G, which has 21 tablets of ossipils with 7 tablets of iron, in which the estrogen E2 is ethynyl estradiol content is 50 microgram and progestin is zero point 0.5 norgestrol. Overall, in L is 50 micrograms of ethynyl estradiol with 0.25 mg of LNG, levonorgestrate. That is your second generation progestin. Mala D is 30 and 0.15. Novolon is 30 and 0.15. Femilon is 20 and 0.15. The Femilon is commonly used in all the adolescent girls, so that all your androgenic side effects will be less in those, and also no need to use higher doses of your hormones in adolescent too. These are the commercially available pills and their names. Newly available contraceptives. Newer pills with anti-androgenic property. Yasmin, that is that contains 30 micrograms of ethynyl estradiol with 3 mg drospirenone, which is also the other name for Yasmin is Dronis 30. These are the commercial names, in which they has ethynyl estradiol of 30 micrograms and 3 mg of drospirenone, Janya, and all, because all these newer available contraceptives will decrease your androgenic side effects such as hirsutism, acne, bloating, breast tenderness, and all. So these OC pills are also called as beauty pills. Newer contraceptives is Jolie, that contains 1.5 mg of ethynyl estradiol with 2.5 mg of normogestrol estate. EE2 in Jolie is identical to endogenous human production of 17B estradiol. Normogestrol is a strong antigonadotropic, mild anti-androgenic properties. So it is best to use this. It is taken as 24/4 regimen, where 24 active pills of OC pills will be there, that is a harmonic pills, and 4 inactive placebos, that is the iron. No pill-free interval is needed when you are giving this Jolie newer contraceptive. The side effects of Jolie is weight gain and acne. Withdrawal bleeding is shorter, lighter, sometimes completely absent. Extended use of OC pills. All your OC pills usually will be given for 21 days, followed by 7 placebos, that is iron. And once they resume their cycle, again from the second day, the next sheet is used. But from in variation to this, there is a extended use of OC pills where it is seasonal. Here, the patients will be using 3 complete months of pills without any remission in the, without any gaps in between the sheets, so that they will have only withdrawal for every 3 months, that is only 4 menstrual cycles in a year. In this, it contains 84 tablets within 7 days gap. That is your ethinylestradiol and levonorgestrel. Usually the extended use of, that is the seasonal OC pills are usually given to the woman who is having a severe premenstrual syndrome or dysmenorrhea or AUB, in which we need to buy some time for posting her for an hysterectomy. In that time, we give an extended use of OC pills for various reasons to increase her anemia status and all, so that she will have no cycle in these 3 months and no PMS, no dysmenorrhea, and no blood loss. In those, we give seasonal use of OC pills. The other type is once a month pill, in which it contains 3 mg of quinestrol and 12 mg of megestrol estate, 2 tablets in the first month, followed by 1 tablet monthly. Liberal, the other use, which is continuously given daily for 1 year, which contains 20 micrograms of ethinylestradiol with 90 micrograms of levonorgestrel. The extended regimens are likely to reduce dysmenorrhea, premenstrual syndrome. They are helpful in increasing the anemia status, or when you want to buy some time for postponing her for planning for an hysterectomy. That is a terminal method for treatment. The mechanism of action of all the OC pills: it inhibits ovulation, it alters the endometrium, it changes in the cervical mucus that interferes with the sperm transport, it alters the tubal motility, it causes the atrophy of the endometrium, it causes the impaired in uterine receptivity. Thus, these all prevent it from the the patient becoming pregnant. Action of estrogen. The other actions beside contraception is action of estrogen. It causes the decrease of FSH release. It prevents the emergency and selection of dominant follicles. It provides a stability to the endometrium. It prevents the irregular shedding and unwanted breakthrough bleeding. Potentiates the action of progestational agents. The other actions of progestogens are: it prevents LH surge for ovulation, it causes the thickening of the cervical mucus, thus prevents the sperm penetration, it thus prevents a fertilization, produces endometrium not receptive for implantation. It also influences the peristalsis of the fallopian tubes, which is a key factor for the sperm motility and fertilization. It counteracts the estrogen side effects like endometrial hyperplasia and heavy menstrual bleeding. The prescription is patient assessment to the prior prescription. That is, prior to prescribing a patient for OC pills, you need to clearly know the thorough history of the patient, her last menstrual cycle, pregnancy status, her medical illnesses, any associated liver diseases, psychiatric diseases, breast carcinomas and all, her addictions such as smoking, any history of medication, her blood pressure measurement, because in hypertensives usually we will not advise occipals. Pelvic examination is not mandatory for a prescribing occipals. Adequate counseling may help to improve the compliance. Why we need to counsel the patient? In order to prevent, in order to educate, so that she will not miss any tablet during her regimen course. Pills to be started, she has to be thoroughly educated on when to take a pill, when to start a pill, how to take a pill, and how she has to continue. Pills to be started on the first day of menses, consistent, and to take pill regularly at same time each day. She has to be educated that when once her menstrual cycle starts, she has to start taking first pill, and after that time, every day at the same time, she has to take a pill. The sheet contains 21 days of pill with 7-day pill-free interval, not to exceed 7-day pill-free interval between the packs. If a woman forgets one or two pills in first 21 days preparation, she has to be educated that she need to take a missed pill as soon as she remembers, and continue taking the remaining pills as usual at same time whenever she started taking the first tablet. If a woman forgets 3 or more pills, then if a woman forgets 3 or more pills, she has to take more recent pill as soon as possible and continue to take the remaining pills. See, if a woman forgets one pill, she has to take whenever she remembers the same pill and continue the next regimen at the same time whenever she is taking. If suppose the woman forgets 3 days of pills, then if she has remembered on the fourth day, need not take for 3 days pills. She has to take 1 day pill at whenever she remembers, and then the next pill continuously whenever she has to take a pill. Use condoms or abstinence until she takes the pills for 7 days continuously if she has an intercourse. If the woman misses taking a pill in week 1, pill-free interval has to be extended. If a woman misses taking pill in week 3, finish all remaining pills in the pack. Omit pill-free interval, start a new pack in the next day, back up for contraception if she exceeds pill-free interval for 7 days. These are the criteria how you need to educate the patient if she starts when you prescribe a OCPL. The WHO medical eligibility criteria for contraceptive use is if a woman's condition in which there is no restriction for the use of contraceptive, that is, if she doesn't have any medical disorders, liver disorders, hypertensive disorders, no addictions, no carcinomas in the family, she can take the OCPL. A condition where the advantage of using this method generally outweighs the proven risk. A condition where the theoretically and proven risk usually outweigh the advantage of using a method. A condition in which represents an unacceptable health risk if contraceptive method is used. See, WHO criteria is divided into four categories. Category 1 is the use any method in any circumstances. Generally use method not usually recommended unless other more appropriate methods are not available or acceptable method not to be used. WHO criteria 1, 2, 3, and 4. In one monarch up to 40 years, the woman can use. These are all the conditions where they have to use. 3 and 4. The efficacy of any OC pill is usually 100% effective if used correctly. That is, if the pill is not missed by the patient. If she takes all the pills without any missing of pill, then it is 100% effective in preventing fertility, that in preventing pregnancy. If the failure rate will be 0.1%, in perfect use, or sometimes you can have a 0.1% of failure rate where where the patient can become pregnant in spite of using regularly the OC pills. Tip: if any missing of pills are there, usually the failure rate is 8%. Here, failure rate of OC pill is the patient becoming pregnant. The advantages is regular pill intake, pregnancy rate is very low. It is simple to use, taking a pill, menstrual cycle becomes lighter, there will be reduction in her symptoms such as dysmenorrhea, will be reduced, the pain will be reduced during the cycles, reduction of anemia because there will be limited blood loss, so her anemia status will be improved. Regular ovulation returns within 3 months after use of OC pills. It also protects against ectopic pregnancies, benign breast diseases, PID, ovarian cysts, ovarian cancers, endometrial cancers. It is a best method for contraception for any female less than 35 years of age. The side effects of OC pills usage is as common as other drugs: nausea, vomiting, headache, dizziness, mastalgia, depression, greasy scalp, acne formation, loss of libido, muscle cramps in legs, breakthrough bleeding. Menstrual upsets, candida vaginitis, weight gain, venous thromboembolism is most common when you use the third generation progestins, that is your gestodon, arterial thrombosis, myocardial infarction, strokes, hyperlipidemia, cancer cervix, risk of dysplasia, cancer in situ increases with use of ocipils for more than 1 year. So when a patient is kept on ocipil, if her age is more than 30 years, you have to ask her to get a pap smear for every 6 months. Breast cancer, it is increased for early premenopausal breast cancers. Risk is directly related to the duration and dosage of ocipils. Enlarged liver on palpation, stop ocipils. Breastfeeding, ocipils should not be given. Ocipils diminishes the quality and quantity of milk production. Migraine, headache, so ocipils have to be avoided. Infertility, no evidence of increased infertility. Ovulation returns to normal within 3 to 6 months after use stopping of ocipils. 90% people become pregnant by 24 months. Amenorrhea, usually we give the low dose of ocipils. Estrogen content is not sufficient for endometrial growth. Progesterone causes atrophic endometrium, and thus her amenorrhea will be there. So there will be curing of AUB. Drugs affecting the efficacy. Drugs which stimulate the liver metabolic capacity affect the ocipil's efficacy, such as rifampicin, phenobarbital, and phenytoin. Uh, Antibiotics can be given safely with any ocipils. Benefits of low dose of ocipils is it is effective. It causes effective contraception, less incidence of endometrial cancers and ovarian cancers, fewer ectopics, regular menses, less salpingitis, less benign breast diseases, and decreased endometriosis. It also causes reduction in the acne, hirsutism, functional ovarian cysts, and reduction in the PMS, that is premenstrual syndrome. Progesterone only pill. This is traditional project POPs taken within 3 hours of same time each day. 350 micrograms of norepinephrine, 75 micrograms of norgestrol, and 30 micrograms of LNG. 12-hour POP. It is that is taken within 12 hours on same time each day. Desogestrel pill, that is seragetate. Commercially available progesterone only pills are the following. POP is recommended in breastfeeding female. The best OC pill given during a breastfeeding is progesterone only pill because they do not affect the milk production. Safe in female with migraine. Efficacy is 0.38 to 0.8 by HWI. Mechanism of action: it causes the thickening of the cervical mucus, causing the reducing the sperm viability and penetration. It also causes the endometrium, unfavorable for implantation. Besides this, it inhibits the follicular development, thus inhibiting the ovulation. Um, Prescription: it has to be prescribed. The patient should start taking on the first day of the cycle, taken on a continuous basis without any break between the parts. Strict time schedule should be advised. If a female is 3 hours late, take the pill as soon as she remembers, and next pill at the usual time. If she misses more than one pill, she needs to take one pill as soon as she remembers, and she has to have a backup contraception. The side effects of POPs is changes in the bleeding pattern, depression, headache, migraine. weight gain, ectopic pregnancy, mastalgias, and mood swings. The other type of OC are hormone agonist and antagonist, that is mifepristone. It is used as an emergency contraception because it blocks the action of progesterone on the endometrium. Thus inhibits the endometrium from implantation. The mifepristone daily dose is 2 mg, weekly dose is 100 mg. The other is centochromone, that is SERMs. It is non-estradiol once a week OC pill included in Nation Family Welfare Program. It causes the weakening estrogen agonist on bones. It has an anti-estrogenic on endometrium and breast, prevents embryonic implantation by suppressing the endometrial proliferation and deserialization. It is given as 30 mg twice daily, twice weekly for 3 months, and followed by once weekly. The rest backup is necessary for the first month. Failure rate of centichromone is 1 to 2%. It is emergency when you want to use the same thing for as an emergency contraception, you have to take 60 mg within 24 hours of coitus. Introduced as free of cost in India under the family planning with the name of Chaya. Side effects: headache, nausea, vomiting, weight gain, delay in return of fertility up to 6 months. Contraindications during the first 6 months of lactation: PCODs, hepatic dysfunctions, and cervical dysplasias or allergy to the drug. The other is postcoital contraception pills, that is the LNG and RU486. In LNG, that is levonorgestrel mini pill. It contains some progesterone, where you have it is also used as emergency contraception, where you will be taking 0.75 mg of levonorgestrel tablets. One tablet should be taken within 72 hours of unprotected intercourse and other within 12 hours later. RU486 dose is 25 to 50 mg, which is effective in preventing the pregnancy. The other emergency contraception is uliprostol and centichromone. In uliprostol, it is 30 mg to be taken within 5 days of unprotected intercourse, and centichromone, it is 60 mg within 24 hours of coitus. These are all the 4 drugs which is also used as, which are better named as emergency contraception pills. That is your LNG pills, that is I pill, RU486, uliprostol, and centichromone. The other type of till now we have discussed all about the female contraceptive pills. Now coming to male contraceptive pills. The only male contraceptive pill is Gosipol, which is an extract from the cotton seed oil, which causes a decreased sperm counts by incapacitating the sperm producing cells. Pills should be taken daily for 2 months until sperms are not absorbed in the ejaculate. Then the pills are taken weekly. Return of fertility is seen within 3 months of discontinuation of the tablet OC pill, that is Gosipol. Investigational approach to inhibit the production of sperm includes Gosipol, which is commonly used. Others are sex steroids and GnRH analogs. These are all comes under male contraceptive pills. Now we have completed both the contraceptive pills, that is the female OC pills and male contraceptive pills. Overall view, coming to the female OC pills, it is combined OC pills and progesterone OC pills. In combined OC pills, we have monophasic, and multiphasic. In multiphasic, we again have biphasic and triphasic. Emergency contraceptive pills are your LNG, that is 0.75 mg. 2 tablets has to be taken immediately, or 1 tablet within 72 hours of unprotected intercourse. Then RU486. Then comes your centichromone 60 mg within 48 hours. Then comes your centichromone RU486. Uliprostol 30 mg tablets, which are usually taken within 5 days of unprotected intercourse. Coming to the male contraceptive, it is Gosipol. Thank you. Any doubts? Hello? Hello? హలో హలో
మ్యామ్ వినపడుతుంది మ్యామ్.
అయిపోయింది క్లాస్.
అవును మ్యామ్.
ఓకే, థ్యాంక్ యూ. గుడ్ డే.